Health authorities are racing to find the source of a new community case of COVID-19, but right now they have no idea where the Auckland student caught the virus. Now, we are expecting the Minister for COVID-19 response to give a press conference at any minute. We will cross live to that as soon as it happens. The woman in her 20s has no apparent connection with overseas travel, the border or managed isolation. She works at a women's clothing store in Auckland's CBD and is a student at AUT, but hasn't been on campus since October. The woman felt sick on Monday and went for a test the following day, but kept going to work at A to Z Collection on High Street while waiting on the test results. Now, health authorities are asking visitors to the store or an apartment block at 106 Vincent Street in Auckland, where the infected woman lives, to take extra precautions. The Minister for the COVID-19 response is heading to the podium. We will cross there now as he begins to speak.
Good afternoon. As we indicated at 1 o'clock earlier today, this morning we were informed of a new case of COVID-19 with no immediately identifiable links to our managed isolation facilities or our border. I want to provide you with the latest update on that case investigation. I'll ask Dr. Caroline McElnay to give you the latest information we've been able to establish. I will then talk about the actions that we have taken so far, the requests that we have of the people who work and live around the Auckland CBD, and then I'll talk about the next steps before taking your questions. Dr. McElnay.
Thank you, Minister. Kia ora tātou katoa. I'm here to provide an update on the Auckland community case announced by the Director-General of Health earlier today. Auckland Regional Public Health Service has this afternoon conducted a detailed interview with the case. We now know that their role at A to Z Collection is in a customer-facing role as a shop assistant. I'd like to take a moment to clarify something important here. This person became symptomatic on the 9th of November, was tested on the 10th of November, was asked to isolate and then went to work on the 11th of November. We now know that this case called in sick to work after receiving the advice to isolate, but after a conversation with their manager, went to work and wore a mask. A to Z Collection is closed today and is undergoing a deep clean. Whole genome sequencing will also allow us to compare the genome of this case to that of other recent cases that we have sequenced, and that will help determine the source of this latest infection. The swab from the case has been received by ESR and is currently being processed. It will be processed overnight with a result due tomorrow. We have successfully sequenced over 1,000 genomes to date, and this includes 169 from MIQ facilities. We are aware of media reports around a fire alarm at the managed isolation facility at the Grand Millennium that saw returnees on the street near today's case's accommodation. The fire alarm was 8 o'clock on Monday, the 9th of November. This is not likely to be a source of infection for this case because she was already symptomatic earlier that day. In terms of contacts of today's case, we have identified 3 close contacts and they are all being followed up, isolated and tested. Close contacts include a colleague of the case and 2 friends. They all report being well. The 2 friends are being transferred to the Auckland quarantine facility as a precaution. One of the friends lives alone in the Vincent residences, the same place as the case. All residents of the Vincent residences have been asked to go home and stay home while testing takes place. Health authorities are working closely with the body corporate, and a cleaning company is going in today to do a deep clean of the common areas of the apartment building, including stairwells, lifts and the lobby. All common areas in the apartment building will be closed. A mobile testing station will be on site tonight for residents in those residences. Today's case also took a number of Ubers to work. The drivers are being contacted by Auckland Regional Public Health. Although the Uber trips were very short, because they were in close confinement, we are asking those drivers to get a test and isolate. Following interviews with today's case, we are in the process of confirming a number of locations of interest that the person visited whilst possibly infectious. These include on Saturday, the 7th of November, from 3:50 p.m. to 6 p.m. at Smith & Cooey's department store on Queen Street. From 6 p.m. to 8:30 p.m, the Red Pig restaurant on Kitchener Street. On Sunday, the 8th of November, from 11:30 a.m. to 11:45 a.m, takeaways from Starbucks on Queen Street and from Sunnytown restaurant Lorne Street. On the same day, from 6:40 p.m. to 6:50 p.m, takeaways from the Gatto House, 332 Queen Street. On Monday, the 9th of November, 11:31 to 11:40 a.m, takeaways from Starbucks Queen Street and from Sunnytown restaurant Lorne Street. Anyone who was dining at the Red Pig restaurant on Saturday night will need to be tested and go into self-isolation until they receive a negative test result. Anyone at Smith & Cooey's, Starbucks, Sunnytown and the Gatto House at these times should watch for symptoms and get tested if they feel unwell, staying in self-isolation until they receive a negative test. This afternoon, around 2 p.m, we have issued push notifications through NZ COVID Tracer for A to Z collection and the Vincent residences. NZ COVID Tracer app users who scanned into either location during the relevant time frames will receive a contact alert advising them to isolate and call Healthline to arrange a test. It's too early to report the number of app users who will have received contact alerts, as the console we use for app analytics is not configured for real-time reporting. Anyone who was at these places around these times should isolate, get tested, and stay isolated until they receive a negative result. Pop-up testing is available today in Auckland, including at the Ellen Melville Centre on Freiburg Place and a testing site at Victoria Park Community Testing Centre. There is also pop-up testing available tomorrow at Key Park Health Centre, 68 Beach Road, and at the Wynyard Quarter Car Park Community Testing Centre on Madden Street. A full list of testing sites in Auckland is available on the Auckland Regional Public Health Service website. Anyone in the Auckland area, and indeed anywhere throughout New Zealand, who has cold or flu symptoms should get a test and stay at home until they have a negative test result. Out of an abundance of caution, we are asking people who work in downtown Auckland to work from home tomorrow where possible. If you must go into this area, please use masks and social distancing while health authorities continue to work to trace the source of this infection. Thank you.
Thank you, Dr. McElnay. We've already moved rapidly while we investigate the source of the current infection. Everyone in the apartment where the case lives is in isolation for the next 3 days, and Auckland Regional Public Health is going to be testing everybody overnight. All of the communal spaces in that building have been closed. The CCTV footage of the fire event is being reviewed for safety. The store in question did not open today. Overnight, the genome is being sequenced, and we will have more information on that tomorrow, and we will do another media update here in the theaterette once we have that information. As you will have identified, at this point, a likely source of infection has not been identified with any certainty. While those investigations continue, we have set out some strong guidance on what we want people in that vicinity to do. So we are asking staff who work in the Auckland CBD to work from home wherever possible tomorrow. Those who can't, please use masks, and of course redouble your efforts around social distancing and around hygiene. Anyone using public transport in Auckland or flying in and out of Auckland should be using a mask. People in the apartment block should remain at home and they should get tested. As Dr McElnay has said, a mobile testing unit's being set up tonight and the apartments will be cleaned. As always, we're asking everybody to observe social distancing, continue to wash their hands, and of course to use the COVID Tracer app so that we can alert you if you are in any way in a more risky situation. Tomorrow we will have more information, and when we have that, we will make further decisions based upon that. That will include consideration of any further adjustments to our alert levels. I do understand that when these cases pop up, they can cause considerable anxiety. But we have a plan. We're currently rolling out that plan. We have shown in the past that it works and that we can stop the virus as we've done before. As we've been saying for the past few weeks, COVID-19 is raging around the rest of the world and it will continue to be an increased threat here for some time. New Zealand remains in a very strong position. The steps that we need to take are simple, but everybody needs to play their part. If we all do the right thing, then we can get on top of this quicker. So please follow the instructions that we've set out, get tested if you're feeling unwell, and wear a mask to protect yourself and others. We know what we need to do, we have a plan, and we've successfully gotten on top of these community cases before. With everyone doing their part, we can do that again.
Why do you have enough confidence to stay at alert level 1 for the time being?
Look, when we made the last decision to escalate alert levels, it was based on a different set of information. At that point, we already had evidence that there was transmission within the community. We already had, amongst a number of likely cases. We didn't, at that point, have the level of cases that we're dealing with at the moment. So it was a different set of circumstances. Now, of course, we will know more tomorrow. We are simply saying that we won't make any decisions around alert levels until tomorrow, but we are asking people to take those enhanced precautions of working from home, wearing masks, observing social distancing, so that we can get that bit of extra time that we need to get more information and make more informed decisions.
Can you explain why this doesn't meet the threshold for having to adjust the levels?
At the moment, the information that we have suggests that this could still be quite contained, and that we could still well, in the next 12 hours or slightly longer than that, find a likely source of infection, be able to do a genomic sequence link to an existing case, and whilst we're still assembling that information, we're putting some enhanced protections in place in the meantime, but we're not saying that we wouldn't make a decision around alert levels. We're just saying we don't have the information to make that at this point.
Are you frustrated that it's taken, I guess, yes, only 12 hours, but we need to work quickly, don't we, in these situations? Are you frustrated you don't have that information?
I think we've seen the system moving very quickly, in fact. There are a lot of moving parts here. Now, I think what you'll see from the timeline investigations that have been set out, a lot of detail has been gone into here already, and that work will continue, bearing in mind that we, as we've said before, we rely on people's memories when we're doing this process, and not everyone can remember absolutely every person that they've interacted with over the course of a fortnight. It's one of the reasons why we stress time and time again that keeping good records is really important for contact tracing purposes. But the genomic sequencing takes as long as it takes. Now, I've been informed by ESR that they are absolutely aware of the imperative of getting us these results as soon as they possibly can, and they will do that. They'll work as hard as they can to get us that result as quickly as they can.
What's your message to the manager who told their staffer, even after they've been told to isolate, to come in with a mask? And managers everywhere?
Look, our advice to everybody is if you're feeling unwell, please stay at home and stay safe. And of course, our advice to employers is please be good employers and respect that when staff ring in sick, you should go out of your way to make sure that they can stay home and stay safe and protect others at the same time.
Are you angry?
That was the Minister for COVID-19 response, Chris Hipkins, giving a press conference there